guys, I am Malaysia Farah from BSN 3-1, student nurse from Islam University, Philippines. And I'm here to return demonstration about nebulization or nebulization therapy. But what is nebulization or nebulization therapy? In medicine, a nebulizer is a drug delivery device that administers medication in the form of mist inhaled into the lungs. Nebulizers are commonly used for treatment for asthma, cystic fibrosis, COPD, and other respiratory diseases or respiratory disorders. Now, for the indication of a nebulization therapy, it includes the management of exacerbation or long-term treatment for COPD, management of cystic fibrosis, bronchitis, HIV or AIDS, and systematic relief of palliative care. Now, from the complications of a nebulization therapy, the most common side effects of nebulized treatment is a rapid heartbeat, jitteriness, and anxiety. And less frequent side effects may include headache, nausea, vomiting, and throat irritation. Serious reactions to nebulizer treatment are also possible and should be immediately reported to the prescribing physician. Now, once we're all done, let's go back to the procedures and process. But what is the process of nebulization? Number one is to administer medication in the form of mist inhaled into the lungs. Number two is respiratory secretions to promote bronchodilation. Number three is to exhibit to improve lung sounds and respiratory effort. Now, for the planning or the gathering of materials, we use nebulizing tubing or chamber. We use air compressor oxygen hookup, some stethoscope, and some ordered prescribed medication and PPE as needed or as indicated. So once we're all done, we can go back to the procedure and follow it. Let's go. Now for the assessment of the following: assess lung sounds before and after use and establish baseline determined to effectiveness of the medication. Number two is assess the patient's oxygenation saturation level before the medication of administration. Next is assess the patient's knowledge and understanding of the medication's purpose and actions. So now we assess the lung sounds. So in the lung sounds, we could, for someone who has asthma, we could hear crackles, fine crackles, pores, or even some normal lung sounds. Now, as we assessed it, next, the oxygenation saturation level of administration of medication. Now, we can only use that on as you all know, we don't have that oxygenation saturation level. Next is the patient's knowledge and understanding of the medication purpose and action. Now for the procedure and implementation, we check and verify doctor's order, checks the patient chart for allergies, and know the action of special nursing consideration such as safe dose ranges, suppose administration, and adverse effects to medication to be administered. So I have here an example. It's sort of example, okay? So once we had that verified doctor's order and so on and so forth, about the 12 rights of the nursing process, we could go to the patient or start the procedure. And first is identify the patient with at least 2 identifiers. When we at the hospital, we use name tags, but we use double identifiers such as name and birthday. So I have here my patient. State your name, please.
Daniel Garcia Alfonso.
And birthday.
February 23, 2010.
Okay. Now is the gather equipment all needed. So I have here the nebulization kit. I have here the nebulizer. I have here the lungs and the sample of medication. Now, the medication I use is my mom had a stroke, and then we had this for his tuberculosis. So, it's calcium sulfate or heparin bromide proposal for 2.5 mg, 500 smg per 2.5 milliliter solution for nebulization calculator. So, it's indicated in the routine management of chronic fibrosis and patients suffering for chronic obstructive pulmonary disease or COPD and who require treatment with both potassium and salbutamol. So we were gonna use these as an example, but not on the nebulization or nebulizer, because our patient is completely normal, so we don't have to use any medication. This is just an example and a return registration. Now we continue to perform hand hygiene. I have here my alcohol and I have here my gloves, and put PPE are indicated. In this case we don't need PPE at all. So place the patient in appropriate position, semi or high filer position. So would you please go semi or high filer position? Can you do it? Okay. Okay. Great. 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 Now we choose okay. Bye tayo. Okay, game. Now we use a nebulization cup from the device and open it with the place we match with the unit medication dose. So here it is, the nebulizer cup from the device, and open it for pre-measure. So in this case we do not use any of it, but in some duties we could put it here and then set up here nebulization cup, and then put it on connected device for the Skype unit dose medication. In the bottom section of the cup, use a dropper to place concepted dose of medication cup and prescribe as a diluent as required. Now we did screw the top position of the place attachment and attach to one end of the tubing of the bottom of the nebulizer and the air compressor. So now we're gonna, by the way, this is an example, not a real nebulizer, but we could connect it here, there. It's hooked up and ready. Now turn on the air compressor. We gonna pretend that it's on. Our oxygen or fine medication at miss is produced in the bulb. Have patient place the mouth, grasp insecurely with teeth. Okay, so we're gonna grasp it all the way up. There, very good, very good. Instruct patient to inhale slowly through the mouth, slowly and deeply through the mouth, and nose clip if the patient is also breathing in the nose, but hold breath and slight pause for exhale. Hold deeply, slowly. As he demonstrates it, we continue to our return demonstration. Now, to continue this inhalation technique until all medication of nebulizer cup has been aerolized, usually about, I guess, 15 minutes. Once the fine mist decreases in the amount, gently flick the sides of the nebulizer cup. So when it's nearly done, we could flick it such as that, and then put it back in for safety. Okay? Now have the patient gargle with lids of tap water after using a nebulizer as necessary to clean the nebulizer according to manufacturer's directions. Now as we go. Now, once we are done, we could remove the gloves and additional PPE if used and perform hand hygiene. Document the administration medication immediately used after medication, and evaluate patient's response to the medication with appropriate time to reassess lungs, oxygenation saturation if order, and respirations. So that is all for my return demonstration of nebulization, and I hope you understand everything I said. So thank you and good day.